are joined by Dr. Chris Luke, and we're talking about immunising, and we're talking about the whooping cough today. But recently there's been a worrying epidemic type levels of whooping cough across the English-speaking world.
That's right, Maura. Over the last 4 or 5 years, it's been spotted in Australia, North America, the UK and Ireland, that there has been a significant surge in the number of cases of pertussis, or whooping cough as it's more commonly known. And in fact, tragically, we had 2 babies died last year, which is pretty unusual in Ireland in the era of vaccination. But we forget that in 1941, before vaccination, 2,000 people died in England. And regularly in Ireland in the 50s, about 250 would die. And in fact, there was a blip in the 1970s, about 77, 78, when there was a scare about the vaccine. And there was a lot of people stopped having the vaccination. And we had hundreds of deaths in Ireland in that year.
But Chris, I remember, say, when I was younger, maybe when I was 10, 11 or 12, I'd have heard my parents talking about, say, other babies around the area having it, and then I really haven't heard about it until maybe last year or the year before.
Yeah, that's absolutely accurate historically, and we live in a post-vaccination era where we've become a little bit complacent. It's a bit like
it's creeping back in.
It's a bit like the antibiotics. We over-rely on them and we make assumptions about them, but you know, vaccination is not 100% effective. About 85% of people who are vaccinated develop the antibodies to a disease, particularly pertussis, and not everybody gets vaccinated. So you know, there are a lot of people who choose to opt out or who miss the vaccination, who end up being incompletely vaccinated, and they're vulnerable, and they're also capable of passing on the disease to others around them.
Tell us about the disease and tell us about the process of vaccination from child to older child.
Well, we've heard a lot about winter virus diseases in the last few weeks, but this is a bacterium. So Bordetella pertussis is the posh name, but it is a bacterium which invades the airways. These are the cilia of the airways, and something that it does, it produces a poison, a toxin, which causes this irritation of the membranes, which produces the cough, and spasms of the muscles in the airways, which causes people to cough. And in fact, the most vulnerable to whooping cough are tiny babies, for example, the first 8 to 10 weeks. And they don't always whoop. The whoop is cough, 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 whoop in inspiration. But in fact, tiny babies can actually stop breathing. So they get what's called apnea. And we actually suspect that some cases of sudden cot death can actually be caused by whooping cough.
And you can't vaccinate a child until the child is what age?
We don't vaccinate until the age of about 8 weeks. That's to do with the immaturity of the immune system, because the immune system would not respond appropriately before the ages of 8 weeks to the various vaccines, the 6 in 1, for example.
Yeah, well, for people who may be worried at home, Maura, that don't know what it really sounds like, we can actually just hear it here now, Doc, and it is actually quite frightening. Yeah.
It's like the child is gasping for air.
Yeah. Well, they're struggling, and then they're kind of an escape inspiration of breath, which it's just the same as a flute. It's because the airway is so narrowed. Now, this is a very frightening disease for everybody who gets it, and of course, most people nowadays who get it are actually older teenagers or adults. And I had it myself last year, so I have a particular interest in this. And it was my bless her was my 93-year-old mum who diagnosed it, because she says that sounds like the disease my friend in Dublin had diagnosed in Tala, the children's hospital part, a few weeks previously. And you know, I'd been to specialist colleagues about this, and I'd had investigations, and I'd had this when I was on holiday. I really struggled for breath. I didn't have the whoop, which often is the case in older people who've been vaccinated like me, but they reckon that vaccination wears off. It not only, as I said, it's not 100% successful, but it does wear off.
Yeah. So what do we do then? First of all, let's say somebody at home, a kid is coughing like that. What should they do? Well,
what we're recommending at the moment is that, first of all, you go through the normal process of vaccination at 2, 4 and 6 months, a booster at preschool at about 4, and then just around about the preteens at about 12, 13, the booster. There's suggestions that people of about 50 should actually get a vaccine. That's a topic for debate. But in fact, the health service in the UK and Ireland have become so concerned about this that they're actually suggesting that pregnant women get vaccinated between about 28 and 38 weeks of gestation, because it's quite safe at that point of pregnancy.
For the child,
and then it transmits the antibodies to the tiny baby before they have the immune capacity to develop their own.
So that could be a good idea, because...
Well, it's potentially good. I mean, we forget that in Africa, routinely, mums are immunised against tetanus because tetanus is so common in Africa. So, you know, vaccination and pregnancy are not necessarily contradicted. The other thing we like to do, if we can, is to give people antibiotics like clarithromycin, erythromycin, azithromycin. These are called macrolide antibiotics. Now, they don't cure the disease, but what they do is they prevent and they reduce the infectivity, so they make you less infectious to others if you have, say, a 5-7 day course.
People die from this, Doc.
People die. You know, they reckon that 300,000 people die globally every year from whooping cough.
That's huge.
We had 250 deaths or thereabouts in the late 70s per annum in Ireland when we had that sort of scare. And, you know, there used to be that number of deaths in Ireland in the 50s routinely every single year before the vaccine was introduced.
So if you have your kids, I mean, really, keep them out of school, bring them to the doctor because it is highly contagious, and get an antibiotic, and that should help.
It's also very important to make sure that those within the family, because 90% of family members or those in the same house as a contact will get it unless you take measures to give them the antibiotics or make sure they complete their vaccination course and
Could
so
you
forth.
take antibiotics as a preventative measure if somebody in your house...
It's recommended that people particularly vulnerable, like pregnant women in the last like 10 weeks of pregnancy can do, and children within the house and so forth. So yes, the key thing is if you have a barking cough or great respiratory distress in that age group particularly, go and see the family doctor and discuss it.
A very quick question, a stupid question. We were chatting earlier on. There's about 10 people with 2 different versions. Is it whooping cough or whooping cough?
It's whooping cough.
Whooping cough.
Okay. We win.
Lovely.
You
we win.
people in the gallery lose.
Because we were chatting to people.
There's a W.
There is a W, and you pronounce it.
Yeah.
You pronounce it.
Yeah.
Thank you, Guy, for that clarification.
What's all the boys?
Because it's a whoop. The noise is a whoop.
Yeah, I was told to change what I said yesterday, but anyway.
Anyway,
Mary.
Dr. Chris, you're a ball of information.
Thank you.
Thank you very much for that. Of course, it is a very serious subject. We have
Yes.
details, of course, on our website.
Yes.